I work as an emergency nurse in one of the Dublin hospitals. Working in the emergency department can be challenging and very demanding most of the time. As an emergency nurse, you must be able to deal with unexpected situations and be able to roll with whatever happens. A pandemic situation demands even more from you. When the news that novel coronavirus, COVID-19, is traveling from China to other countries was received, preparations were underway in our department as well. This included briefing every day with all possible information, infection control measures, additional questions at triage, preparing isolations area, and the list is endless. Face mask became an additional uniform accessory, which then added to a face shield and full personal protective equipment as the situations demanded. Visitors were restricted and staff became the family for patient, with an ever-increasing number of phone calls as there was no family allowed with the patient. You then be the messenger, answering their queries, alleviating their fears, anxiety, while delivering holistic care to the patient to the best of your ability. The emergency department of our hospital got restructured and expanded into the near departments when the surge happened. Daily briefing of situation, new policies, infection control measures, familiarization of new changes in department, additional safety measures in certain procedures like intubation. Moreover, to emphasize that we are all in this together. Establishment of COVID and non-COVID pathway, creating isolation area into a different part, minor injuries, and few cases in another area made the staff to be scattered in all areas. You may see some of your colleagues in the beginning and at the end of the shift. Tea room was the only place where you could relax and have a chat, was now restricted for only 2 people at a time. It's all for your safety, but we missed our small talk and the laugh, a way of venting out and boosting our energy. Working with the full PPE on, you need extra strength in your body and mind, and to know how to keep yourself calm. Few hours in the gear, you feel that you are working in a furnace. Sweat sweeping under the clothes, strings of face mask tight on your ears, and the goggles digging on your nose and forehead. Even worse, if you have your own glasses under the goggles. You may be breathing rapidly and your heart beating fast as you deliver care until you realize and try to calm yourself. Neither your patient nor your colleague can hear you properly or see you smile while the gadgets are on. Slowly, you are getting exhausted, dehydrated, with heat and workload, desperately wanting to come out of the PPE. However, your colleagues are also busy in other parts of the ED because our normal ED is still functioning. As always, someone will be coming to relieve you, keep you going. At the end of the shift, after 12 hours or more, the relief when you come out of the PPE is unexplainable. You take a deep breath as if you are not breathing for the whole time. You come across a mother with possible COVID symptoms who is more worried about her daughter at home with underlying respiratory condition. On the other side, an elderly man is dying and you are helping the wife and the son to put on the full PPE to be with him for a few minutes. It is heartbreaking to make her understand why she can't stay with him for long and to reassure her that he won't be left alone, while also having to ensure that they doffed off the PPE properly and washed their hands. On another occasion, a collapsed elderly lady who is in cardiac arrest is brought in the back of a van and the staff naturally jumped into action, forgetting that they are not in full PPE. It turned out to be a COVID positive case. As you are trying your best to adapt to the new situation, help your patients with the best care possible. Liaise with family and other multidisciplinary team. You are fighting with your own fear and anxiety. Fear of getting infected, bringing the infection to your family. Grief, as if you lost a family member when a healthcare worker died of infection in some part of the country or world. And the increasing anxiety with the news from other countries. Uncertainty about the disease itself, and so on. Reaching home after work exhausted. Uniform straight into wash. All work items in a separate area. No more family hugs. Staying alone in a room, away from other family members. Small children banging at the door, looking for their mom or dad. No visits to the elderly parents. Overseas nurses unable to travel back home, and whatnot. In spite of all fear and worries, all nurses turned up for work, did additional hours, helped each other. Management tried their best to make sure all supplies are there and keep up with the morale of staff. All staff from cleaners, porters, caterers, multidisciplinary team to the top management stood hand in hand in the war zone. Being a Catholic, my prayers gave me strength, and I kept my colleagues and the whole world in my prayer. One thing I have to say, Corona gave us the feeling that we healthcare workers are a family all over the world. We battled so far and will give our best again to continue. Together we can achieve more. I am proud to be a nurse, and I am proud of my colleagues all over the world. We have shown the world that we have a key role in the public health. These are some of my reflections. The whole experience is beyond words. Thank you.